Mr McMillan.
Thank you very much, Presiding Officer. First of all, I'd just like to remind the Chamber that I'm the Vice Chair of Moving On Inverclyde, a local addiction service. I'm just erring on the side of caution by reminding the Chamber of that. Presiding Officer, I'm pleased to have secured this important debate, and in advance I'd like to thank my colleagues from across the Chamber for their contributions tonight, but also for those who have signed the motion to allow this debate to take place. The title of tonight's debate is Scotland's Liver Cancer Crisis. Might appear drastic to some, and up until recently I didn't realise that liver disease and liver cancer was such an acute problem in Scotland. Yet figures from the British Liver Trust show deaths due to chronic liver disease in Scotland have increased by 85% in the last 3 decades, and surged by almost a fifth, 19.3%, during the pandemic between 2019 and 2021. Now, sadly, Scotland has consistently had the highest mortality rate for liver disease in the UK and one of the highest in Europe. Now, these two facts paint a very harrowing picture, and when you consider that 90% of liver disease is preventable, tackling this situation becomes even more urgent. Also, the main risk factors for liver disease and alcohol misuse, obesity and viral hepatitis. However, the liver has a remarkable ability to actually regenerate and repair itself. If diagnosed earlier, liver damage can be reversed and risks can be drastically reduced through diet, exercise and drinking in moderation. Despite this, a quarter of liver disease patients die on readmission to hospital, and deaths after discharge have not improved in 2 decades. Clearly then, we cannot continue with the status quo. We must consider new ways of preventing and treating liver disease. Policies like the minimum unit pricing are, however, very welcome, and from talks I've had with the British Liver Trust and others, clinicians in England and Wales want to see this policy replicated UK-wide due to its positive impact in Scotland. But minimum unit pricing alone is not driving down preventable liver disease. As well as looking at other policies to address alcohol-related harm, we must tackle the availability of junk food and encourage people to make healthier choices. Now, that is difficult in the cost of living crisis. Now, that is all the harder when you consider the health inequalities which make obesity and alcohol misuse more likely in deprived communities, such as part of my own Greenock and Inverclyde constituency. During the recent meeting with the British Liver Trust, I was told that Inverclyde reported the highest rate of alcohol-specific deaths in 2017 to 2021, the majority of which were caused by alcohol-related liver disease. Now, marginalised and disadvantaged groups are also most at risk of viral hepatitis, including people who inject drugs, that's with hepatitis C, and migrant communities from endemic countries, that's hepatitis B. Now, alarmingly, 1 in 2 people with hepatitis C live in the 20% most deprived areas of Scotland. And that's why I was so determined to secure a members' debate on this issue, as it's something which evidently is having a major impact on the lives of some people in my constituency. Yet when people think about cancer, there are certain types that typically spring to mind first, most likely because of prominent charities or campaigns focused on specific types of cancers. But importantly, that greater attention is given to liver cancer, as it has seen the largest increase in mortality rates of all cancer types over the last decade. Now, Presiding Officer, you may be aware that I've also been raising awareness of bladder cancer, hosting Fight Bladder Cancer's first Scottish parliamentary event in February of this year, as it's not one that people often think of when they hear the word cancer. Reducing the rate of liver disease amongst Scotland's population is not going to happen solely through policies like minimum unit pricing or taxing unhealthy foods. And we won't prevent more deaths by just asking people to change their unhealthy habits. Now, these policies have a role to play, an important role to play, but we need to improve patient pathways for the early detection and management of liver disease. Now, 3/4 of people are diagnosed with cirrhosis when it's too late for effective treatment or intervention. So we must improve detection rates and work to get treatment in place as soon as possible. And that's why I support the British Liver Trust's call for new national guidance on liver disease to improve early diagnosis, including through the national rollout of the intelligent liver functions tests and fibroscans in primary and community care. Now, some colleagues will have had the opportunity to undergo a fibro scan yesterday if they visited the British Liver Trust's Love Your Liver Roadshow. Now, these free scans are quick, easy and painless, and the Love Your Liver Roadshow unit has private rooms for people to have the scan. As the fibro scan checks for signs that your liver has been damaged, I'm hoping to bring the Love Your Liver Roadshow to Inverclyde, so people in my constituency can actually access this technology, which could lead to them learning if they might have liver damage and, and being given a letter to take to their GP for further investigations. I also agree with the charity's call to expand treatment and support for people with alcohol-depending, specifically integrated non-invasive tests for liver fibrosis and alcohol services to target high-risk dependent drinks. Alcohol recovery services will understandably, at least in the first instance, focus on helping people progress on the recovery journey and to live a life free of addiction. But it's crucial that these organisations are supported to work in partnership with health services to ensure that people receive the health care that they will need as a result of their alcohol dependency. Presiding Officer, in closing, I hope that today's debate will give us all a greater impetus to work towards improving early detection and survival rates for the less survivable cancers, including liver cancer, and hope that this will be at the heart of the Scottish Government policy making going forward. Thank you very much.